With early voting underway, North Dakotans are deciding if adults can use marijuana recreationally. Measure 2 would legalize the personal use for adults over 21, allow individuals to possess up to 1 ounce, and grow up to 3 marijuana plants. However, a list of associations opposed to legalization continues to grow. Josh Menny sat down with the spokesman for the main opposition group, who says the evidence against marijuana is stacking up.
Healthy and Productive North Dakota spokesman Luke Niferatos joins us now. Luke, thank you so much for being here.
Thank you for having me.
Now, your group is opposing Measure 2, or the legalization of recreational marijuana in North Dakota. And, a lot of people say it's just weed, it's not that addictive, and it's less harmful than alcohol. So what are your main public health concerns with the legalization of recreational marijuana?
Yeah, so the big thing we got to know is that we are not voting on joints and Woodstock weed in North Dakota when November 8th rolls around. We are going to be voting on a new high-potency marijuana that we've never seen before. The potency back in the 70s, 80s, 90s was 3% potency. Now we've got products that are up to 99% potency, okay? So it is a totally different drug. Everything you knew about marijuana, you can throw it out. And so this new supercharged marijuana is coming in the forms of concentrates, candies, gummies. They're targeting our kids with this stuff. And the harms are much worse now. So with this new high potency THC, what we are seeing is an increase in addiction. So now 1 in every 3 people who use marijuana in the last year, the new high potency weed, will develop an addiction now. We're seeing addiction rates skyrocket. We're seeing 25% increase in every state that's legalized marijuana for marijuana addiction among youth. So youth are more addicted than ever after legalizing in legal states. And then the other thing that we're seeing is with this new high potency marijuana, we are seeing increases in mental illness. So if you use today's high potency weed, you are 5 times more likely to develop schizophrenia or psychosis. And this is not just one study, folks. This is dozens of studies we're seeing on this brand new drug right now that are telling us there are huge mental illness concerns. So those are 2 of the big concerns we're seeing with today's high potency weed. And the reason why we're seeing that is because big tobacco and big alcohol have invested more than $6 billion together into the marijuana industry. They are changing this drug. They know what to do to make it more addictive. They want to make a profit. That's what this is about, not about kind of taking care of patients or helping people.
Now, there's the concern that the legalization of recreational marijuana would put more impaired drivers on the road. What are the outcomes of recreational legalization elsewhere, such as in Colorado?
Yep. So my state of Colorado, I live here in Colorado, just south of Denver. We were the first state to legalize marijuana. We have seen a doubling in the number of people dying from marijuana impaired drivers on the road since legalization. Washington State saw the same thing happen. We just had a major national study done showing huge increases in deaths on the road across the entire country from marijuana impaired drivers now that so many states have legalized it. So definitely will increase impairment on your roads. I will tell you, in Oregon, half of all the people they tested for marijuana on the roads last year tested positive for marijuana. So huge amount of impairment we're seeing on the roads right now.
Luke, thank you very much for your time.
Thank you.
And you can visit KXNet.com to see our interview with David Owen, the manager of the pro-marijuana campaign, New Approach North Dakota.